Hello, everyone, and welcome to our session here today. We're very excited to be having this webinar event, Nursing Leadership at the Intersection of Climate Change and Health, Influencing Policy and Systems Change. This event is co-hosted by the International Council of Nurses and the Alliance of Nurses for Healthy Environments as part of the health program of the UN Climate Change Conference, or COP26. My name is Kara Cook. I'm the Director of Programs with the Alliance of Nurses for Healthy Environments. And as you are seeing in the room as well as online, we have some folks virtually attending this webinar as well as in person. So it's very excited to have everyone here and to have such engagement from the room. The theme that has been echoed throughout this COP is that the time for action is now. And nurses, who make up the majority of the health workforce, are well poised and can make a powerful contribution to both mitigate climate change and to support people and communities around the world to adapt to its impacts. I'm thrilled to be joined by representatives from both the Alliance of Nurses for Healthy Environments and the International Council of Nurses, as well as three phenomenal nurses who are exemplifying nursing leadership on climate action, influencing and advocating for change at institutional, systems, and policy levels. And to share opening remarks, I'd like to turn it over to Howard Caton, who is the Chief Executive Officer of the International Council of Nurses. Over to you, Howard.
Cara, thank you so much for helping to put this session together. I'm very conscious you're going to hear from some fabulous nurses during the next hour, and I don't want to stand in the way of that. But I do want to say that I'm delighted how we as ICN have been able to come together with other nursing groups, with other healthcare professionals, and to ensure that the healthcare professional voice has been louder, I think, than it's ever been before in relation to climate change. We are in absolutely no doubt that human health and planetary health are intimately intertwined and interconnected. And as you will hear, it is because nurses see in their daily practice the impact of climate change on individuals, their communities, and health in both a physical, a mental, a psychological sense, that we have a very legitimate and authoritative voice, I believe, in relation to climate change. And of course, you know, with just hours to go, and whether a deal is in sight and whether we're going to hit 1.5 or not, we are some of the key people who are going to have to deal with the consequences, with the fallout, with the outcome of whatever the result of these negotiations are. I did want to say that you're going to be hearing from my colleague Erica shortly, who'll tell you much more about the detailed work that ICN has been doing. Climate change has been a strategic priority for our board. We recently supported the WHO launch of their report and the healthcare professional letter, and I noticed that we were starting to get some pushback on social media for intervening, for nurses and health professionals intervening. People who were criticizing health professionals for, they're trying to reframe climate change as a health crisis, suggesting that in some way it was it was a trick or it was non-legitimate. And in response to that, it's just made us more determined to call out the fact that climate change always has been a health issue. When people have gotten sick as the planet has warmed, and it is nurses and healthcare professionals who've had to care for those people, but who haven't just treated the symptoms, have looked to the cause, and the cause is climate change. So those people who perhaps think that we're reframing in some way perhaps need to look a little bit more closely at the original picture. I suspect that some are also a little nervous about the authority of the voice that we bring. Nurses, doctors, many of the healthcare professionals consistently come out as the most trusted of all healthcare professionals. There are lots of reasons for that, but I just wanted to also highlight that one of the key reasons, I believe, is that nurses around the world work to a code of ethics. ICN has just recently revised our code of ethics, which is used by many nurses around the world. And that speaks to the principles of nursing practice, of respect, of non-discrimination, of the upholding of rights, but it also includes a section on global health and the importance of sustaining and protecting the natural environment because of its relationship to health as well. So it's not just an issue of nurses seeing the impact of climate change in practice. The voice that we're exercising in relation to climate change also comes from a place which is about the ethical foundations on which nursing practice is founded. Enough from me, and I, like you, really looking forward to hearing the voices from some of the nurses on this call who will tell you in much more detail about the relationship between nursing and planetary health, and delighted to be able to support this along with our colleagues from the Alliance for Nurses for Healthy Environments. Thanks, Cara. Back to you.
Thank you so much, Howard. And then I'd like to turn it over to Katie Huffling, who is the Executive Director of the Alliance of Nurses for Healthy Environments.
Thank you, Cara. And I want to say thank you to ICN for your wonderful partnership in bringing this event together, and to the WHO for your work elevating climate change as a critical health issue. Also, thank you to everyone joining us here today and online, and to our wonderful group of nurse experts. Your leadership on climate change and sustainability is truly inspiring. For those who don't know our organization, the Alliance of Nurses for Healthy Environments, we're based in the US, and we work with nurses and nursing organizations around the globe at the intersection of health and the environment. Being at COP26 for the past week and a half has really highlighted for me how important nurse leadership is now and will be over the next few years as we try to prevent the global temperature from increasing more than 1.5 degrees Celsius. As the largest portion of the healthcare workforce and as one of the most trusted professions, we have a moral duty to work together and with our health colleagues to transform the health system into one that is regenerative instead of extractive. We have the skills and training to eloquently provide the compelling stories, along with the science that can help inspire our patients, communities, workplaces, and policymakers to take strong climate action. And we have such an amazing opportunity to improve health and prevent disease when we address climate change. Also, with our vital role in combating the pandemic, we are in the public eye as never before. We can harness this increased visibility to show the public and policymakers how nurses are working to address climate change and urge them to join us in addressing this urgent public health emergency. This past June, Patricia Butterfield, Jean Leffers, and Maribel Diaz-Vazquez published the paper Nursing's Pivotal Role in Global Climate Action in the British Medical Journal. They provide a framework for how nurses can expand their role in addressing climate change, and the examples of nurse leadership our panelists will be describing here today provide real-world examples of how nurses are already filling these roles. This framework consists of 5 recommendations. First, accelerate change by leapfrogging nurses into leadership roles, which includes elevating nurses into executive leadership roles, building partnerships globally amongst nursing organizations, and paying nurses for their climate change work, which I think is very important. Second is give nurses and nursing students the skills they need to create the future. This includes mandating climate change in nursing education curriculum, integrating sustainability and climate change into professional education, and educating individuals, families, communities to deal with mitigation, adaptation, and resilience strategies. Third is rekindle activism, advocacy, and relentless truth-telling. By amplifying the voices of nurses and advocating for policies that promote planetary health, increase biodiversity, and decrease air and water pollution linked to climate change. The fourth is ensure a global lens by extinguishing Western-based biases in climate action agenda of nursing. We do this by promoting the voices of nurses of low and middle income countries within the climate change arena and adopt successful climate change strategies developed in low and middle income countries as models for countries around the globe. And the fifth is put equity, justice, and morality front and center by including health equity in all climate action agendas. Endorse an intercultural approach in indigenous areas to guarantee the right to health and a healthy environment. Holding corporations and governments accountable for their role in this climate emergency, and advocate for healthy communities for all. Again, thank you to our panelists here today, and I look forward to hearing about your roles in nurse climate leadership.
Thank you so much, Katie, for providing those powerful comments to get us started on this webinar. I'd like to now turn it over to our colleague at ICN, Erica Burton, who's going to share global perspectives on nurses, climate change, and health. And just to introduce her, Erica is a registered nurse, certified global nurse consultant, and senior policy advisor on the nursing and health policy team at ICN since 2015, and is leading the climate change and health work at ICN. Over to you, Erica.
Thanks so much, Kara. Hello, everyone in Glasgow and online. Thanks for joining us today. For those of you who don't know, ICN is the global voice of nurses, and we're a federation of over 130 national nursing associations around the globe. So with 27 million of us, it's clear that we have a very loud and very important voice. So for the next few minutes, I just wanted to cover from a global perspective and from the perspective of ICN what this role in climate action looks like and some of the work that ICN has been doing in this area. We've seen that nurses are and can be leaders in the climate space to create not only climate resilient health systems, but also things like raising awareness within the nursing profession, within the health profession, and in our patients and communities, mitigating climate change and supporting people and communities to adapt to its impacts as well. And we're very strong advocates. I think this is because, as Howard said, we're already witnessing and responding to the effects of climate change on the health and well-being of people. And so we're already leading in this area. We're seeing people who, have bronchitis, have worsening asthma from air pollution, from the wildfires that we've seen across the world in the last few years. Nurses who are working with children in rural areas are seeing, really high death rates in children under 5 from diarrheal diseases because they don't have access to safe water sources. So I would say that we are already leading and we're already pretty strong in this area. But there's certainly more space and more that needs to be done. So what needs to be done? First of all, we're very strong patient and community advocates. And so we can be the voice for climate vulnerable populations. Of course, we know that climate change is hitting those who contribute the least to it and who are the most vulnerable. So, for example, when nurses are in the community caring for older people or for people experiencing homelessness who have heat exhaustion and heat stroke, we've seen this year these intense heat waves that are happening, not only in Australia, but all the way around the world in the north in Canada. And so just, looking out and standing up for these vulnerable groups is one of the, strongest areas that nurses can be in. I think that this topic is somewhat new for nurses, and we have to be a little bit honest about that. And we know that in some countries, we see nurses engaged in climate change, but in other countries, less so. So just raising awareness of the health implications of climate change, how to assess them and how to address them, I think is really important for those of us who are already engaged in this work. And this can be done at many levels. For example, ICN encourages our NNA members to develop policy documents on the subject to get members and their members engaged and informed in the topic, as well as at the education level. Nursing educators are working and will need to continue to work to to embed the concept of both sustainability in healthcare, but also climate change related knowledge into nursing curricula. This also goes for post-registration and continuing education as well. We also know that our chief nursing officers at the country level have a really important role, and their role in developing national action plans around this for policies for mitigation, for adaptation, for resilience strategies, I think is really important, and then including in environmental health and justice policy making as well, and not only just in the health sector, but in other areas. Within health systems, nurses can lead and support the development of models of care that reduce, for example, unnecessary travel, which we've seen a lot during the COVID-19 pandemic, and the impact that has, or the positive impact that has on our environment, or climate-informed health programs for emerging infectious and communicable diseases is also another example. And then as well at, nurses on the ground level, we encourage nurses to get involved in environmental health committees in their places of work, and policy development that looks at, the safety and protection of health workers, but also the management and the regulation of the healthcare environment. And then within that, we can also advocate for policies that reduce healthcare waste and support correct waste management. And then there's also the important piece of having nurses engaging in health and climate research. And I know that Katie mentioned the article in the BMJ, so that's a fantastic example of how we're getting into research and publications. So ICN has been working, as Howard mentioned, over the past few years with our members, our NNA members and nurses around the world to help the nursing community engage with this issue. In 2018, we released our position statement, which you can find on our website. And also, we sit on the WHO Civil Society Working Group to advance action on climate and health. And this was a group that was formed in 2017 that brings together the WHO and representatives of leading NGOs around the world to tackle climate change. And it looks at healthcare system reform, research, peer education, advocacy, emergency response, and policy development. And so members work not only within their own agendas, but also collaboratively to try to increase this engagement of the health sector in climate change. We are also proud signatories of the Healthy Climate Prescription Letter, which I know was released this week. And I hope that you were able to sign that, or you're able to attend the launch of that. And that was to 197 of the government leaders at COP. With over 300 organizations. It was an extremely powerful letter. And examples like this are very powerful examples of how we can use our collective position, including, as Howard mentioned, as the most trusted healthcare provider, but really as a health team and a health community to advocate for policy change. The last thing I'll mention as well is that there is also a need to build capacity within the health workforce and within nursing to react as well to disasters. And so we've seen this very clearly during the pandemic. But last year, ICN released the new disaster competencies. And these are used by national nursing associations, nursing education programs, organizations participating in disaster. And so I encourage you to go look at those and to use those as well in the work that you do. So with COP having this health focus for the first time, I have no doubt that these activities around this area will only increase, and we're really excited about that. So thanks so much, Kara, and I will turn the floor back to you.
Thank you so much, Erica, for providing that framework for how nurses can be working at the intersection of climate and health. And being here on the ground, I want to echo Erica's comments about how health really has a big presence here at this COP, and that is very exciting, and that's the first time that has happened. And I just want to, before turning it over to our panelists, I just want to briefly mention an initiative that Annie has been working on, as well as in collaboration with a number of our partner organizations around the world. We have been working over the past 6 months on a climate justice agenda for nursing, which we will be officially launching tomorrow. And as nurses, we know and witness how climate-related impacts are unjustly burdening people in frontline and frontline communities. And so what this agenda for nursing does is it seeks to identify a path forward for nursing that centers the worldviews and knowledge of those who have been historically marginalized, and to act as a starting point in developing and advocating for effective long-term solutions to bolster human adaptation and health, as well as safeguarding ecosystems for community survival. And through this work, we aim to stimulate a global dialogue for nurses and to collaborate through research, education, and practice to advance climate justice action. And we know this agenda is just a starting point, and we are welcoming nurses around the world to provide feedback and comments as we collectively work towards solutions to address the climate crisis. And so I'm thrilled to be here with 3 amazing nurse speakers on our panel who are going to provide some of those concrete examples of how nurses are working at this intersection of climate and health. And so our first panelist will be Dr. Patricia Schwertel, who is an emergency nurse with 15 years of experience working in a range of healthcare settings in Australia, Europe, the Pacific, and Africa. She is now a researcher specializing in climate change and health, working toward her PhD on climate-related migration and health. Tricia has worked with Doctors Without Borders since 2007 and is involved in humanitarian governance. The floor is yours.
Thank you. Yeah, just to clarify, I'm not a doctor yet. When I have my PhD, I'll always be an RN. So just to clarify, but thank you very much. Thanks for this opportunity to speak about nursing leadership for climate action. I think something that is really resonating with me at COP this week is the scale and the nature of the change that's required to stay under 1.5, and that's quite shocking. And that shock can kind of lead to 2 reactions. One is like it's really empowering and motivating, and the other is that it's quite disempowering and it's quite easy to despair about that. But as nurses and midwives, as my colleagues have said, the largest group of health professionals also representing a very large component of the vote. We have a very critical role to play in this transition. And there's 2 things that we need to do to mobilise, I think. One is to empower ourselves and not wait for anyone else to empower us. And also to better understand how change happens. So we talk a lot about the what of change, but we don't talk much about the how of change. So when we train health professionals, there's 3 ways, or there's 3 steps. The first step is teaching knowledge and skills in order to build experts. The second step is about teaching values to build professionals. And the third step is teaching advocacy to create change agents. And we're not very good at all at that third step. As nurses and midwives, we're used to advocating for individual patients, but less so communities, and even less so the planet. So we're very new to that. And it's also in terms of thinking more about the how of change rather than the what. I think we have to recognise as well that the nature of change is changing. Like it used to be very much about the organogram and about, governance, top-down change. But now it's much more decentralised, and it's about your ability to influence through a network. So when I teach leadership to nurses and midwives, I talk about leadership in terms of a trait and a quality, and it's not a job title. And that really simply put, leadership is about seeing a problem or an opportunity and doing something about it, and not waiting for someone to tell you how, and not waiting for somebody to give you permission to do so. So if we're going to accelerate change, we're going to have to do that and empower ourselves to do that. So I'm just going to briefly explain 3 stories of change that I led that could be replicated. So we talk a lot about scaling up change. Here's 3 examples that any nurse anywhere in the world can kind of take something away from at least. The first one's about education, the second one's about governance, and the third is about research. So I work as a lecturer at Monash University in the School of Nursing and Midwifery, and we were able to integrate climate change and health and environmental sustainability into the undergraduate curriculum. We did that as a learning objective, which means it needs to be assessed. And it means that when I go, somebody else has to do it after me. So that's an important element of change too. It shouldn't really rely on you. So I suppose I think of this example as change as windows and doors. The window part is that you get pockets of opportunity for change that you need to recognise. Sometimes they're less easy to recognise, and sometimes they pass without you having that opportunity. But this example was a curriculum review. So every 5 to 7 years, health professional curricula get reviewed. So if you're the right person at the right time, you can build a strong case to integrate climate change and health into the curriculum. And the other part is about doors, really. So it's about pushing on doors. Sometimes they don't budge. Sometimes they open a little bit and you can get your foot in. And sometimes they slam in your face. The point is that you have to keep on trying to push on those doors. So a couple of other ways that you could integrate climate is when your professional body is reviewing their code of ethics, why not try to get environmental sustainability? I mean, the evidence is there to make a very compelling argument. If your professional body is reviewing the professional standards or your accreditation standards, climate, environmental sustainability really, really needs to be there. And the other one is like just opportunistically, often hospitals and healthcare organisations do consultations to update their vision statements, and that's an opportunity to get environment and climate in there as well. The second example is from Médecins Sans Frontières, Doctors Without Borders. The world's well-known and probably the biggest emergency medical humanitarian organisation. So this is a story of effective advocacy. Although they're called Doctors Without Borders, more than half of the MSF workforce are nurses and midwives, and the vast majority are locally hired staff. So this is also a story about citizenship rather than customership, which is, I think, the way that we need to think about ourselves. The MSF movement is an association-driven movement. The model of governance is bottom-up. So once you've done a project with MSF, you join the association and you have the opportunity to shape and guide the direction of the movement. So this story is also about existing and new change levers. So there's lots of existing change levers that if you recognise them, you can pull on them for effective advocacy. And this one is the opportunity of writing a motion. So the association can actually write a motion, and if it's successful and gets enough international support, it can rise to the highest level of international governance, which is the International General Assembly. And that's what we did. So we really wanted MSF to invest more in nursing and midwifery. We wanted them to acknowledge nurse and midwifery research in their operational research strategies, to develop professional development and professional and promotion frameworks for nurses and midwives, and also to ensure that nurses are working at their full scope of practice. Because when nurses work at their full scope of practice, not only do people have better access to healthcare, but that healthcare is also safer and it's a higher quality. So although this example isn't really about climate change, it is, once you empower nurses, the philosophy of nursing is quite different to medicine in 3 ways. One way is that it's more about the socio-environmental model of health that integrates the environment, and also it's very much orientated toward prevention. And we know the lowest emissions from any healthcare intervention are the ones that are avoided. And thirdly, it's very much embedded in communities. So by empowering that philosophy of nursing within the MSF movement, we're heading in the right direction. The third example is research. So I became a researcher now because I think research has the enormous power to change. And nothing is really more infectious than an idea. When you have the evidence, because we're so evidence-based, evidence-obsessed, you can really find ways to create change that kind of sets off cascades of change. But I think we also have to think more strategically about research questions. It's not just about the gaps in the research that we can fill and get a paper published about, but it's about the kinds of research questions that will set off these cascades of change. And there's a couple of good examples of that. I think the health co-benefits of mitigation body of research is very powerful, because not only does it show, it's a very compelling argument for decision makers, because it shows that not by mitigation we can reduce emissions, but we can also have health co-benefits and social co-benefits and financial co-benefits. The other research that I really like to do is synthesis research. At AR1 in 1991, we had 2,000 articles to synthesize for the AR1. And in 2021, for the AR6, we have 350,000 articles to synthesize. So it's a huge task that can't really be done without machine learning. But it's a good question to ask, do I really need to do another primary research project? Or is it better to synthesize the last 10 years of research on this topic to create a higher level of evidence, which is much more likely to influence policy? So just to summarise, the scale of change is really overwhelming, and I think we all have a role to play. A good way to talk about, I think we need to talk more about the how of change rather than the what, and 4 ways to think about that is windows and doors, and existing change levers, and also creating new change levers. So the 3 examples that I gave were about education, governance and research that can be replicated in other settings, and I'm happy to speak to any nurses that want to talk about doing that. At COP26, we've really been talking about putting health at the centre of climate policy, and as the largest group of health professionals, there should really be a nurse at every decision-making table regarding health and climate action. Thanks a lot.
Thank you so much, Trish. I love that. Nurses at every decision-making table. So important. So we're going to turn it over to our folks virtually. I'm going to introduce our second panelist, who is Dr. Erlinda Palaganas, and she is a full professor and scientist of the University of Philippines, a tireless and staunch advocate for nurses and people's welfare, as well as various issues on social determinants of health. She is largely known among the Philippines community health nursing pundit as a leading expert in qualitative research and in her contributions and unwavering efforts to achieve equitable access to healthcare for Filipinos. I'll turn it over to you, Dr. Palagas.
Hello, good evening, everyone. I apologize that I couldn't put on my video. It's just that my internet, my connection is quite weak, and opening it will further aggravate the situation. But nevertheless, I'm here to share whatever concrete experiences we do about climate change. So I am representing a chapter of the Philippine Nurses Association, and this is the Baguio City chapter, and of course in the region, being the governor of the Philippine Nurses Association Cordillera Administrative Region. So by the way, the PNA Baguio City chapter is the most outstanding chapter of the Philippine Nurses Association for this year and for the year 2018 and 2019. And I would like to say that this is one of the things that we do. One of the good things that we do. Jennifer mentioned earlier that advocacy is a difficult thing to teach, but one of the good things that the PNA Baguio City chapter does is advocacy, and one of which is the story that I shall be mentioning. Next slide, please. So in terms of declaration, the declaration of conflict of interest, I think I don't have anything to declare, and whatever slides I have here are from my own, from the people's organization that I work with, from the Philippine Nurses Association Baguio City chapter, from a good friend, a community health nurse, Jewel Salvador, and also one slide from Google. Okay, so I would like to say that we at the Philippine Nurses Association in the Cordillera Administrative Region assert the people's right to health, and this is basically enforcing the intersection of health and climate change. And if you will see in this picture, climate change definitely can affect health by the difficulty. I mean, the Cordillera Administrative Region is one area where it is difficult to reach. And climate change has also further aggravated the situation through various landslides, road cuts, raging waters when the rain falls. And so it further aggravates inaccessibility to health. Next slide, please. And these are some of the geographical areas that I go to. I am a public health nurse, and I do research intensively in the communities here in the northern part of the Philippines. So I say here that raising awareness and critical thinking, the power of stories, the power of lived experiences through case studies and sharing research outputs to our students in the various colleges of nursing, in the various schools of nursing, not only in our region, but all over the Philippines, is a very strong and powerful method of raising awareness and critical thinking. Next slide, please. And one of the case studies that we would love and we have supported with women's organization is the effect of climate change among indigenous women, because the part that I belong to is inhabited by indigenous women. And one of the researches that was conducted by Inabuyog and Seawork is, which we have assisted and which we have also helped in propagating, is climate change in indigenous women in traditional agricultural communities in this part of the Philippines. Because here, women know when there is a change, and this has something to do with the product, with the amount of produce that they have in the lands that they have. Next slide, please. And I think I have mentioned earlier that climate change and access to health services do have a relationship, and we try to show these pictures to our students and try to tell them what the relationship is. Next slide, please. So I'm telling you some powerful pictures that we get when we go to the field, and such as the impact of climate change on crop loss, as I have mentioned, so that when there are changes, when there are long months of drought or long months of rain, then crop loss is affected. Next, please. The impact of climate change further on crop loss through long rains and landslides. Next, please. And also the loss of other food sources and biodiversity arising from climate change. Like, for example, even in rivers, the amount of what do you call this, of food sources from the rivers are also affected. Next slide, please. And stories about when you have reduced water level, that it also affects whatever food sources that would come from the river. Next slide, please. And other effects such as this, you will see a hanging bridge that we would normally cross when the water level rises because of upstream water would gush in. And this is due to denudation. This is due to illegal logging, and this is due to deforestation as well. Next slide, please. And also, the impact of climate change results also to more pests and diseases. So that would also contribute to hunger, that would contribute to loss of crops. And so the cycle of poverty and the cycle of poor health continues in the community. Next slide, please. Okay, as I've said, no, poverty and hunger. Next slide, please. And so education and advocacy from communities to grassroots level, which we really go down to the people. We tell them about the results of our researches. And the height is when we also go down to the streets to tell our whatever the results of our studies are, and to push for policies, to push for the administration to do something about the situations that we find in the communities that we serve. Next slide, please. And yes, this here is a Cordillera woman from Inabuyog. This is a group of women's organization in the Cordillera who would talk about their conditions, and one of them is the effect of climate change. Next slide, please. And I also joined a if you have time you can watch this. There is a interprofessional pledge for planetary health, of which I represented the group. And usually we show this to our students because this is another way of pledging or trying to let advocates. It's like a Hippocratic oath or a Florence Nightingale oath, but it has something to do with planetary health. And it's usually a very good way of impacting the communities or the students as well. And the last slide, has something to do with the call from the APWID. The urgent concern of rural and indigenous women is to address the climate change crisis and to look at how the dominant socioeconomic system has breached ecological limits and destabilized the planet's climate. So teaching climate change is not very easy. Even doing research is not also very easy because for one, operationally defining terms for students, corporate greed, climate change, globalization, and all these things are things that we really have to let our students, let nurses, professionals understand at this time. And it's indeed, this is the time to do it. And it will not have to be postponed, not tomorrow, not next year or next month or next week. I think the urgency to do something about climate change has started, and it will have to restart again today. Thank you very much.
Thank you so much, Dr. Palaganas. It's so great to have you here and to have you share your experiences of how climate change is impacting the Philippines and how you all are working to mitigate and adapt to those changes. And so I'm thrilled to introduce our third panelist, who is also joining us virtually. Dr. Elizabeth Schenk is the Executive Director of Environmental Stewardship for Providence, one of the largest nonprofit health systems in the United States. Under Dr. Schenk's leadership, Providence has set the boldest climate goal in U.S. healthcare to become carbon negative by 2030. And she and her team are transforming the health system to decarbonize operations while building resilience in the communities they serve. So I'll turn it over to you, Dr. Schenk.
Thank you, Kara, and thank you all for this opportunity. And it's marvelous to hear the work of my colleagues. Thank you. Next slide, please. So we have heard why nurses are so important to not only the decarbonization of healthcare, but for the climate crisis writ large. To amplify a few points that have already been made, with millions of nurses globally, the work of transforming healthcare cannot be done without nurses. Further, nurses bring crucial skills that not all professions have. We have technical know-how, we are systems thinkers, able to address complex features of health all at once: physiology, genetics, and disease, family, social resources and relationships, finance, education, and spirituality, all important aspects of health. We do this with care, in the deep ethicality of our profession, and we can bring these same skills to the climate crisis, which is also complex from many voices and viewpoints, with success being dependent on a fierce commitment to equity. The world needs nurses now, as nurses care for billions of people around the world and for the world itself. Next slide. I'm going to tell you about Providence that Kara mentioned, one of the largest nonprofit health systems in the US. Our vision is health for a better world. Next slide. Providence is large. We have 52 hospitals, over 1,000 clinics, 120,000 employees, including 36,000 nurses. Next slide. We offer services in these 7 Western states. If you're not from the US, these are along the West Coast of the US and in the Intermountain region. Next slide. On Earth Day of 2020, and I remind us that that was right in the middle of the pandemic, we announced our goal to become carbon negative by 2030. As Kara mentioned, this is the boldest goal in US healthcare to date. And alongside a fabulous team, I, as a nurse, am leading the work to get there. We are addressing all 3 scopes of greenhouse gas emissions, which is enormously challenging. Our commitment rests on our core value of justice, and we know that climate change is lethal, and further, that it harms more vulnerable communities the most. Thus, if we are to be true to our commitment to justice, we must address all of our carbon pollution from all aspects of our organization across both direct and indirect emissions. Next slide. I have worked in healthcare environmental stewardship for over 2 decades. Based on that experience, I developed the We Act framework. You can read about this in the journal Creative Nursing. We Act is an acronym standing for waste, energy, water, agriculture, food, chemicals, and transportation. We are now using this as a guiding framework in Providence, and we believe that these 5 broad categories cover at least 90% of our greenhouse gas emissions. You can see here some of the activities that we're doing in each of these categories. We have an enormous strategic plan, and we have many projects underway at once. You can use this framework just in your own mind. When you walk into any facility, any home, any organization, how are they doing? How are we doing using the We Act framework? And I remind you or point out the obvious that it also means that we act. We won't solve this crisis without action, and we won't solve it unless we work together. Next slide, please. Because of our commitment to justice, we are focusing on environmental justice in the communities we serve. We are learning about more specific environmental risks from Alaska to Texas. We are expanding the lens through which we see community health to include the environmental determinants of health so that we can help build climate resilience, especially with the most vulnerable. Next slide. We are developing a clinical collaborative for environmental stewardship. So it's obvious that healthcare exists to deliver care, and that's primarily from clinical experts like nurses. We have in Providence 90,000 people who are either licensed clinicians or who spend their time engaged with patients and families, and almost half of that group is nursing. Yet very often when an organization works on environmental stewardship, they don't include clinicians. This is understandable, I guess. After all, clinicians' time is valuable. We're busy, we're doing urgent, fast-paced work every day. This is all true, and yet who is better suited to transform practice? It's the clinicians. So we're starting our clinical collaborative. When we look across the clinical disciplines, we have already identified over 50 projects to address to transform clinical practice toward being environmentally safe and healthy. You may know that in the US, our standard of practice number 17 states that the registered nurse practices in an environmentally safe and healthy manner. So nurses will be crucial to the success of this work. And I look forward to creating opportunities for nurses to get involved and contribute because so many of us want to do that. Next slide, please. I have just a little more time, so I'm going to tell you about 3 other examples of my leadership. Next slide. Many of you have heard of nurse-sensitive quality indicators like CAUTI, CLABSI, falls, pressure ulcers. These are thought to be directly related to nursing care. My colleague Sarah Johnson and I have proposed the concept of nurse-sensitive environmental indicators. We have interviewed experts in the field in a qualitative study across the United States to explore this, and we have learned that using the WEACT framework as a basis, the categories in green here, waste, agriculture, food, and chemicals in particular, stand out as being nurse sensitive, or aspects of care that nurses are engaged in frequently and can impact more immediately. These are good places to start when working with nurses. Next slide. So get out your phones. I have 3 QR codes. The CHANT is the climate and health tool. This has been developed by Kara Cook is one of the co-investigators and 2 other investigators. And this measures awareness, behaviors, and motivation related to climate and health. It began as a tool to measure nurses, but has been expanded to all health professionals. So if you hold your phone up to that QR code on the left, that will take you directly to the survey, or the QR code on the right will take you to the CHANT website so you can learn more about the tool and how to use it. Next slide, please. And lastly, my last example is the Nurses for Healthy Environments podcast that I do for Annie. I've recorded and produced this since 2017, and it has been amazing to interview nurses around the world working at the intersection of health and environment. I see some of your names on the list of attendees today, so thank you for participating. This fall, we have produced the Climate Justice Series that Kara referred to about the announcement tomorrow about the Climate Justice Agenda for nurses. And Dr. Robin Evans-Agnew has interviewed 11 nurses so far. In the new year, we will offer the Nurse Climate Champions series with Dr. Shanda Demarest, founder of the Nurses Climate Challenge. Fabulous leaders themselves. Please check these out. Next slide. I end by saying it is an honor to work with nurses to contribute solutions for this incredible challenge of our climate crisis. Nurses continue to blow me away with their smarts, their heart, and their commitment. Besides that, nurses are fun, and working together, we make the load lighter and go further. Thank you very much.
Thank you so much, Dr. Schenk. Your leadership is truly inspiring. And so we do have some time for questions, and we'll try to take a couple from the audience and perhaps one from the virtual audience. And I do just want to remind our speakers to, if you can keep your responses brief so everyone can chime in another time for questions. Do we have any questions from our live audience?
Hi, my name is Nicola. I'm a nursing student from the United States, from Boston College. I just wanted to direct my question at Patricia. You were talking about sort of how we can influence education, nursing education, and making climate action and environmental health a bigger part of that. I'm wondering if there's anything that students can do in order to be able to influence that. I know we're not necessarily always at the decision-making tables, but that's sort of my like locus of control and power right now. And so I'm wondering what your advice is for that.
Yeah, that's a good question. And actually, a lot of the momentum around integrating climate change and health into the curriculum has come from students. So students are consulted in curriculum development. And so like I was saying before, sometimes there's windows that you can't see. So it would be worth finding out from your education institution, you know, when are you reviewing the curriculum, and then mobilizing, like getting some people together and seeing if there's any way that students can influence that curriculum. Yeah, and there's so much work around the world going on with this, and it's also in lots of different disciplines. And the learning objectives around climate change and health and planetary health are shared amongst different health professions. So it's worth having a look at papers like the AMI Consensus Statement for Planetary Health. That was an international, interdisciplinary effort to really articulate what are the knowledge and skills, the values, and that we need to teach the next generation of health professionals. And we hope that with that, the level of climate literacy will really rise so that we face fewer barriers when people practice. So that's kind of like the bigger goal.
Thank you so much.
And thank you. And I'll also mention in the U.S., the National Student Nurses Association has done some really amazing work, including releasing a policy statement on climate change and health, which is very fantastic. And I just want to remind folks who are virtually, if you'd like to ask a question, because we don't have the ability to see your hands raised, if you could just enter it in the chat and we'll grab a question that way. And we'll take one more question from folk in the room. I think I saw you. Okay, we'll go to you in the back.
My name is Rainer, and I work with Trish at Heidelberg University. I'm a doctor. So it looks a little bit as if you try to work alone as nurses, as the doctors do, so that we have two silos, which is not a good idea, I think. We all, not all, many doctors are completely not on this agenda, but many are. And so I think there should be a health worker unified approach. And I give you an example. We started a MOOC. By the way, MOOCs are great tools for disseminating knowledge everywhere, irrespective of diploma and so forth. And we did a MOOC for doctors on climate change. And Trish was the first to say, hey, why do you focus it on doctors and not on us or on all? And now we are going to do a one for health workers after that. So I think we should try to work together. I know it's not easy. I know many of you have bad experiences working with our crowd, but I think the ones that are climate sensitive, they will immediately link up to you and are very pleased to work with you.
Thank you for that question. And perhaps I'll turn it over to our panelists virtually to see if we have a response.
Sarah, it's Howard. If I may come back on,
please do.
I'll come back. Yeah, it's from our colleague, the medical colleague, very well made point. And just to assure you that at the international level, the International Council of Nurses, we work very closely with the World Medical Association, the International Organization for Physiotherapists, the Organization for Pharmacists as well. There's something called the World Health Professions Alliance, which brings us all together. We all supported the sign up to the health professionals letter that 46, 47 million health professionals around the world have already signed up to. So there is some collaboration, but I absolutely agree. We always need to make sure that we're growing, that we're developing that as well, that we don't stay in our own professional silos. And I just wanted to pick up again the question from the student, just an observation on that as well. I think I think there's a part of the debate now which is really important to recognise how COVID and climate change are compounding and impacting on one another. So, you know, COVID is exposed for the fragilities, the frailties, the inequities in our health systems. Climate change will just exacerbate those even further, might lead to even more infectious diseases as well. So a lot of the global country health policy debate and discussion is in relation to how do we build back stronger? What does future healthcare look like? I did a paper with Elizabeth Ero, who's the Chief Nursing Officer, which was in the BMJ earlier this year, looking at future models of health care from a nursing point of view, which had sustainability at the heart of what those models could look like. And on a very, very practical level, I think a lot of the nurse-led models of care are sustainable models of care. Nurses who are supporting people with chronic and long-term conditions, not in a hospital setting or environment, but remote and rural, enabled with the right technology as well. I think that we have in nursing some models of health care which are good for patients, which would also be good for the planet. So to the student and the younger nurses' voices as well, wade into that debate and discussion about what our future health models and systems should look like, and the leading roles that nurses can play in all of that. Back to you, Karen.
For that response. And we are coming close up on time, so I do want to get to one more question from our virtual audience, and just a reminder to keep responses brief here. In light of burnout and exhaustion from working through a global pandemic, how can we empower and support each other to advocate for climate justice whilst acknowledging this?
Kara, I would jump in briefly.
Please do.
Only to say that I was really surprised when we launched our program at Providence right during the pandemic. I thought to myself, we will never make progress right now on climate. It's just too much. This is overwhelming. People are exhausted and scared. And that's all true. But what I found was people were relieved to talk about climate change. Now, I would have never predicted that 5 years ago, because it's usually got kind of a bummer topic. You know, people are afraid of climate change. But what I found was people were relieved that we were taking it seriously, relieved that our eyes were open, relieved that we had a plan. And so I think by, at least from my perspective, by engaging, inviting, including, and celebrating the contributions of nurses, this is a way that this can be a real positive, even though the pandemic is continually grueling. But I think there's a reason for the optimism that comes from action. Thank you.
And can I just add also, echoing Beth as well. In May 2020, at sort of the one of the peaks of the pandemic, there was a letter that was sent again from nurses, doctors, and other health professionals, and it was sent to G20 leaders. And we thought, oh boy, no one's listening to this, but they were, and they do, and that's for some of the reasons that Beth mentioned, but also because it's so interrelated, and people are hungry for connections that allow us to move through and forward with this, but also to prevent disasters and health crises like this in the future. And climate change does just that, and it's so connected to the pandemic. And to burnout and to all of the things that we're discussing. And so, yes, it is one of these sort of highlights of people's days when they get to work on issues that bring us forward and through, I think.
Thank you so much.
If I may add as well to what has been said, I agree with Beth. I agree with Erica as well as Howard. I think we should not let the pandemic stop us from advocating. And I guess I would like to encourage that the lines of communication be open. The ICN is there. I guess the ICN should lead. How many countries are there as a member of the ICN? And I guess you won't go wrong. If that collaborative system is strengthened, there will, as you have said, the voice will be there, and it will reverberate in the various halls of the world. So let's keep the lines open, and let's just keep moving. Thank you.
And what a great way to end this webinar with those comments from Dr. Palaganas. And so I want to thank you all for joining us here today. It's been such a pleasure to have our 3 panelists, and as well as our partners at ICN joining us and co-hosting this webinar. So I want to thank our panelists as well as ICN for partnering with this. And I hope this has given you a little snapshot of what nurses are doing around climate change and health, and we are eager to collaborate with anyone in the health profession and beyond. So thank you so much for joining.